Hello, friends. Welcome back to the Say What podcast. I am so excited that you're joining us today. And I'm especially excited because we have our first guest since the new relaunch of the podcast. And I am so excited for our guest today. We have been internet friends for a while now. I've been following Lindsay on Instagram for, I don't even know how long at this point. I think some of my followers were like, you've got to check out her page. Her page is so good. Like she healed my pelvic floor issues. And I was like, okay, absolutely. I'm following. And so we've been internet friends for a while, and I'm so excited to have you on the podcast. Oh, I guess I should say her name. This is Dr. Lindsay Massumi. Did I say that right? I'm always like questioning saying people's names because I want to make sure I'm getting people's names correctly. But you know how sometimes when you say like something in your head so many times and it's like the wrong thing, then you like can't correct it when you're actually
Yes.
talking. That is what I'm always like so scared of, that people's name wrong. But anyway, I'm so happy to have you on the podcast. Thank you so much for being here.
Yes. Thank you so much for having me. I'm so excited. And it's so funny that you had so many people tell you to follow me because I tell people all of the time to follow you. And
Oh, thank you.
yeah, I'm like, I don't even know how I found you in the first place or how I discovered you. But I just remember I was like, this is a great resource and a great person to refer so many of my patients to. And
Thank you.
so,
I
yeah, you have
appreciate
just
that.
been like such a good voice in the community of just purity culture and what happens to the pelvic floor sometimes when we're in kind of like a toxic purity culture, and how does that contribute to all of these things. And
I know.
so
It
it's
plays such a
yeah.
big role. And I just like had no idea how much purity culture really affected us and our bodies until you take a step back and you're like, oh, why does sex hurt so bad? And it's like, oh, because I was told it was bad my entire life. No
Yes.
wonder my body is affected by that. That's just, of
Right.
course. It's almost like duh. It's not like a duh moment, but it almost feels like it sometimes. It's like, well, of course that's gonna happen. But when you're in it, you just like don't realize it. So
Yes, exactly.
a lot of women experience that. It's not fun. It's not fun.
Yeah.
So why don't you tell us a little bit about yourself, who you are, kind of what you do, like general overview of who you are, so they can get to know you a little bit better.
Yeah, absolutely. So, like Hannah said, my name is Dr. Lindsay Massumi. I am a pelvic health physical therapist by training, and then I also am a women's health coach online. And so, kind of a combination of everything you see in the prenatal postpartum space with pelvic health, nutrition, stress management, sleep coaching, all the fun things there. But yeah, I basically I got into physical therapy a long time ago. I knew I wanted to be a physical therapist probably back in middle school when I was a
Oh,
competitive.
wow.
Yeah. So it's been like a long goal of mine.
Did you know in middle school that you wanted to specifically do pelvic physical therapy?
No, I didn't even know that it was a thing
Yeah,
back
I
then.
definitely would not have even known that existed.
Yes.
Yeah.
But that definitely, like, around the time that I started to go to physical therapy for myself for ankle injuries from competitive gymnastics, I did start to experience a lot of, again, looking back, pelvic floor symptoms. And
Mhm.
so it kind of makes sense how I made my way into the realm of the pelvic floor. But at the same time, again, growing up a competitive gymnast, I also grew up in the Catholic Church, and just I don't know. I've always kind of had this fascination with pregnancy and postpartum and like
Yeah.
sexual experience, but then you grow up in the church and that's very like,
Don't talk about it.
yeah, hush, hush, don't
Yeah.
talk about it. And I just remember again, receiving a lot of shame from individuals as well as experiencing a lot of shame and a lot of guilt for just having wonders and questions and like wanting to know more about my body and more about this and like how
Mhm.
everything worked.
Yeah.
And
Which is
so
a very
again,
normal, natural thing, but
yes,
apparently we have to be like, you can't even know the names of your body parts. Like we can't even tell
exactly.
you what your vulva and your vagina is called. We have to call it like a Lulu or whatever.
Right,
Yeah.
right,
We're
exactly.
cringe saying those words, like
I know. Or even
not
like,
not the actual anatomy, like the cover up
yes,
terms. Like that's
yeah,
to me than calling it what it's actually called.
exactly. Um, but yeah, so again, I had this huge fascination with the body. I had this huge fascination with pregnancy and just like women's health and like periods. Like, who, what middle schooler can be like, I'm so excited to get my period? But I was like, this is like such a cool thing. And like, I can't
Yeah,
believe all this
yeah.
stuff happens. And so I've always just kind of had this fascination. And so as I started to enter into the world of physical therapy, I really loved the sports aspect and I really loved working with women in sports. And so that's kind of how I, again, started shifting a little bit more towards this pelvic health, women's health space. As I was like, well, there's so many women that would benefit from strength training and, learning how to move their bodies better and just be stronger in general. And then you realize there's this huge population that very rarely feel strong. And that's because of pregnancy and postpartum.
Yeah.
And so I was like, well, that's like, again, can kind of combine my two loves here. And
Yeah.
so just over the years, I started being introduced more and more to pelvic health physical therapy. My sister had an experience with seeing a pelvic health physical therapist during her first pregnancy. Then I
Yeah.
ended up doing research in the space and I was like, this is really cool. Like
Yeah.
I should go into this. And again, all at the same time, I'm having this parallel basically experience myself of all of these pelvic floor issues, pelvic floor dysfunction, kind of spanning from, again, a lot of that shame, a lot of that guilt, a lot of that just feeling like I needed to hide my body given my upraising and everything that I had kind of experienced. So a lot of it, I was like, let's figure some of this out. What is going on here? And
Yeah.
again, kind of just connect it. Like it really helped me and obviously just really transformed me to
Yeah.
say the least. And so like again, thinking back 10 years ago, if you if you had told me I was going to become a pelvic health physical therapist and I'd be talking to people about like pain with intercourse and like
Mhm.
how to have penetrative sex with your husband
Yeah.
after you've been married for several years and never able to do it or
Right.
like how to get past that and how to actually enjoy intercourse.
Mhm.
Again, if you had told me that would be my life 10 years ago, I would have thought you were crazy because I couldn't
Yeah.
even
Yeah.
say the like I couldn't even say the
Say the
word
words.
sex.
Yeah. Yeah.
Like or again like vulva, vagina, like you
Right.
would have
Right.
never caught me even saying those words. And now that's what I do on a daily basis is helping people overcome
I
pain
love
with
it.
intercourse or leakage or
Mhm.
prepare for pregnancy,
Yeah.
recover postpartum, find their strongest version or their best version of themselves.
Yeah.
And so,
No,
yeah, it's kind of come full
I was
circle.
so inspired watching all of your pregnancy content, when you were pregnant. Because how old is your daughter now?
Excuse me. She just turned 10 months today.
Turned 10 months. I knew that her and Tate were only a couple months apart, so she just turned 10 months. But I loved watching all of your pregnancy content, and it was just like so inspiring for when I like have more babies in the future and like things I can do this time around. Hopefully, I won't be as sick as last time, but I was just so encouraged watching how you're preparing your body for birth and just preparing your body for postpartum as well. Because when I was like pregnant, I wasn't even thinking about like trying to prepare my body for after the baby. I was just thinking like, okay, what are some things I can do to prepare myself for birth because I want to be the most prepared for birth. I didn't even think like, oh, I should prepare my body for how I'm going to pick up my child out of the crib and like stuff like that you're talking about. I just was like, oh my God, I didn't even like think about preparing myself for that. And so I just
Mhm.
think this stuff is like so cool what you're posting. I just remember being so like encouraged and inspired by like all of your stuff. And also I do think that this is like a funny, just quick story. I was so shocked whenever you ended up having your baby and you found out it was a girl instead of a boy. I just thought that was so funny. I mean, probably not funny because you were probably shocked, but could you just like tell that story real quick? Because I was like telling my
Yeah,
husband about it when it was happening, and he was like, I don't know what I would do if I was like preparing
that's
and it was something else.
right. That is the reaction most people give us or they
Yeah.
tell us. And like even again to this day, people will still tell me that. They're like, I still cannot believe. And I'm like, I know. It is
Yeah.
pretty crazy.
Yeah.
So yeah, long story short, I guess we did like an ultrasound, kind of like just one of our friends got us in during lunch at the 12-week ultrasound. So it
Uh-huh.
wasn't like an official one. So really the only official one that we did was the anatomy scan at 20 weeks. And we
Mhm.
didn't want to know in the room what the sex of the baby was. So we asked them to write it down on a card. And then they never pointed anything out
Yeah.
in the ultrasound or anything. So we went home with this envelope, like card sealed up,
Mhm.
that they had handed to us. And we opened it basically like a week and a half later on New Year's and it said boy. And
Yeah.
so like
You're
why
like,
would it be wrong?
boy. Yeah.
Why would it be wrong? Yeah. And so we just
You just don't even
basically,
think like you don't even consider like, oh, if this is gonna be wrong? It's like, okay, they said boy, so it's a boy. Like it doesn't
right.
cross your mind that it could not be a boy.
Yeah. Especially like at the 20-week scan or
Right.
like I was almost 21 weeks at that point. And
Yeah.
so it should have been pretty obvious, you would think.
Right.
So I don't know what they
You
saw,
would think
but
you would think it should be pretty obvious.
right. So basically, again, I have a home birth. We never do any other
Which was
scans because
amazing, by the way. Watching all of your stuff with your homework, like
it
this
was so
sounds so
cool.
weird, but I could not get enough. I was like, I have got to see all the things that she's talking about. Like, I
Yeah,
was so intrigued by it all because I was just
it was
it's
amazing.
such it seemed from the outside, it just seemed like the most beautiful, empowering experience for
It
you.
really was.
Like,
It really was.
I think I
Yes.
interrupted you. I'm sorry, but ended up
You're
doing it.
good.
You just didn't even,
Yeah.
yeah.
Yes. Yeah. So again, never did any other scans. I went into labor actually before I even made it to 40 weeks. And so had I made it to 41 weeks, we would have done another scan. And I was going to ask them to confirm because I kept joking towards the end of pregnancy. I was like, well, they say it's a boy, but like all we have is this little card written down and like no one else has ever confirmed it. And
Yeah.
yeah, so then baby was born. It was like the middle of the night. I was in the bathtub in our bathroom.
Yeah.
All the lights were off. We just had this like basically the essential oil diffuser going, which had some colorful lights, so very dark in there. Baby's born in the water.
So serene, it looked like.
Yeah, yes, but again, when babies come out, they come out face down.
Right.
And so again, my like baby came out, husband grabbed her, which we now know is a her, grabbed her, put her on her chest or put her on my chest. And of course, then they just started wrapping the baby in
Right.
blankets and whatnot.
Yeah.
So it was probably a good 5 minutes, and everyone just kept being like, oh, he looks so good. His tone is good. He's perfect. And you can see in all the videos, like my eyes, like just starting to question and think
Yeah.
in a way. So
Did you
finally,
guys already have like a boy name picked
oh
out?
yeah.
You like calling him his like boy name whenever you
Um,
tell him?
right. Yeah, we were basically about to announce the name.
Oh,
And yeah, because they were like, well, what's his name? And I
oh,
was like, did anyone actually check to make sure it was a boy? And no one had. And so I held up the
okay.
baby. I'm still in the tub, but I held up the baby and the
Uh,
umbilical cord was between the legs. My husband moved it and we all just stared and it got really quiet.
oh
And no
my
one said anything. And finally, I was like, it's a girl, right? And they were like, yes,
God,
that is a
that's
baby girl. So to this day, we don't know exactly what happened or how they mixed that up at the scan, but yeah,
but meant
it
to
just
be.
goes to
She's
show
perfect.
again.
So beautiful. I just think it's so funny
Right.
that it's like it's not what we thought.
I was gonna say God always has a plan, even
Oh, no,
even
totally.
when you think you're gonna find out things to like plan for the future.
Right. It's like,
No.
no, no, but I just think that's like just the most fun story. I mean, not probably, I mean, I'm not the one who lived it. I'm sure it probably came with some emotions, but
I look back and I definitely like I don't have any hard feelings about it. Like it was
yeah,
always very yeah, it's
just
a fun story.
yeah, yeah, for sure. Okay, cool. Well, thank you so much for like just kind of telling the listeners and us a little bit about you and how you got started. I really wanted today, since you talk so much about pregnancy and postpartum, to talk about a little bit about postpartum and how that like can affect your pelvic floor because unfortunately in our country of the United States of America, it's like you push out a baby and that's it. Like they don't talk to you about your pelvic floor at your 6 week appointment. They're just like, you look good. They like spread your legs. Yep, you look good. Some people don't even have that. And they just like have a Zoom or like a phone call. And it's like, how you feeling? You feeling good? Great. And there's like zero follow-up from then. It's just like, okay, you're good to go. That's it. And it's not even like any kind of conversation about like how are you feeling? Do you feel like you're healing? How are you feeling emotionally? Do you have any questions about how you should even start to like introduce sex or intercourse again? Like there's nothing. It's just like you just pushed a 8-pound baby out. Good job. And then you're done. Like there's just no follow up, no conversation. And that's not the norm. Like in other countries, pelvic floor physical therapy is the norm for women to have an experience. And so I just wanted us today to talk about postpartum with your pelvic floor and with women's bodies in general. And then also maybe you can provide some like tips for how to like ease back into intercourse because I know that it can be so scary. And I remember people even asking me like, why are you scared to like have sex again? And I was like, because I just don't know anything. I have no idea of what it's going to even be like. And so I think it'd be good for us to talk about that. And then I asked our Instagram community for some questions, and I got a couple good questions from people. Some questions we'll already answer in the episode, but I have a couple questions from some listeners that we could talk about. So that's kind of the outline of our episode that we're gonna chat about today. So let's just go ahead and get into talking about postpartum and just why, I mean, in your experience, in your practice in the medical world, even your personal experience, like postpartum pelvic floor, like I said, we go to the doctor and they're like 6-week checkup, you're good. And it's like, what does that even mean? How am I good? So let's just like talk about why pelvic floor physical therapy could even be beneficial for women to go to like after they give birth.
Sure. Yeah. So I think the first thing to note is just the importance that your OB or your midwife or whoever delivered your baby is really good at that. They
Mhm.
are not going to be an expert when it comes to pelvic floor function,
Yeah.
or like returning to exercise postpartum or returning to intercourse. Like their job really is, to make sure gynecologically or like obstetrics wise, if we're talking specifically like delivering babies, that they are, they want to be sure that is all good. So when it comes to postpartum, I think it's really important too to just remember that like pelvic floor physical therapists are going to be the experts in this. And they're going to be able to provide you with way better advice and guidance than your OB too.
Definitely.
And so I think again, we've kind of like, I don't we always say we're like, okay, you go to that 6-week appointment and they're like, all right, you're good to do everything. And you're like, what do you mean I'm good to do everything? And they're like,
Right.
whatever feels good. And that's not their fault that they're saying that necessarily,
Yeah.
but what they should be doing is saying like, just why don't you go to pelvic floor PT? And
Yeah.
so I think that's where pelvic floor PT is really, really handy. Even like everyone should be given a referral, regardless of whether you want to go or not, or whether you're experiencing symptoms. Every single person should be given a referral to pelvic floor PT. Like
Yeah.
you said, that's not quite standard in the US yet. But
Yet. Yes, that's a good word. Yet.
yes, but basically what happens when we go through pregnancy and we go through birth is, I mean, pregnancy alone is a huge stretch and change on all of our muscles, our joints, our ligaments, our entire body, just what your body has to do, like cardiovascular wise, even, is insane. And so it's really, really important to rehab those muscles after pregnancy, and especially after a birth. So if you had a vaginal delivery, those muscles are going to go through an enormous stretch. I think they say it's like 3 to 4 times their normal resting length.
Wow.
So like if your hamstring got pulled 3 to 4 times its normal resting length, pretty sure you'd be going to physical therapy afterwards.
Definitely. Definitely.
Yeah. Or, if you had a C-section, your pelvic floor still went through a lot of those changes of pregnancy. And then to top it off, you had a major abdominal surgery, which is
Yeah.
actually the number one surgery in the US. The number one performed surgery in the US is a C-section. And then
Wow.
again, we don't routinely refer people to pelvic floor
Um,
PT.
And I still think
Even
it's quite bizarre that people say that the C-section is the easy way out. I'm like, I could never imagine saying that to somebody who just had a C-section. Like you are cutting through layers and layers and layers and layers and layers of your skin. Like, how is
yeah,
that the easy way out? There's no easy way to give birth.
no, there
Anyway,
is
we
no easy
frustrated me
way.
so much with that
Right. Yeah,
stereotype. But
right. Exactly. But again, regardless, whether you had like a textbook physiologic birth
mm,
or you had your plan Z when it came to your birth plan, your
mhm,
body still underwent huge, massive changes. Your pelvic floor is definitely going to be impacted. And
mhm.
just the way that those muscles function and fire are
Yeah.
going to be impacted. And so when they go through a really big stretch, and then we need them to heal, what tends to happen is everything kind of comes back in. It's like a rebound effect or like a rubber band effect. So it's going to snap back in. And sometimes, and I would say probably more often than not, those muscles are going to kind of snap back in maybe an over tightened position potentially.
Mhm.
And so that's where a lot of people start to run into issues postpartum. And maybe it's not even like an over tightening. It's just like we never really learn how to use those muscles appropriately again because we didn't rehab them like we would
Right.
any other part of our
Right.
body.
Yeah.
Um, and so again, that's where we can start to experience dysfunction and issues. If things can over tighten or if they get stuck kind of in this over tightened state, we tend to see things like pain with intercourse or difficulty, whenever you get your postpartum period, difficulty with tampons or
Yeah.
cups or discs, like things feel off. Maybe you're even getting like leakage or hemorrhoids, constipation, tailbone pain, back pain, hip pain. Like a lot of those are signs of pelvic floor tension. And
Yeah.
again, if we're not appropriately strengthening everything around that area postpartum, pelvic floor is going to tighten up even more, trying
Mhm.
to kind of make up for that lack of strength. So,
That makes
So,
sense.
I mean, like, that's a huge scientific explanation.
Yeah, no, no, no,
Um,
that makes sense. Because I think
but
people,
yes.
women postpartum too, may not even know what a symptom is. They may just think like, okay, I guess like I gave birth and I guess this is normal now. Like it's always the or statement of like, oh, well, if you sneeze when you pee after you have a baby, it's just because you had a baby and that just is what it is. And it's like, no, it doesn't have to be is what it is. That's not like that shouldn't be a normal thing. While it is common, it is not normal. And I think people get those confused a lot with like something being common, meaning it's normal. And so women may not even know like what to look for, like what could be a symptom.
Mhm.
I'm glad that you explained all that, especially with like the period part. And like you may not have had pain before, but now you're having pain with that. And that's good to know that that's not normal as well.
Right.
Women struggle with like inserting things.
Yes. Well, and I think too, like again, we talked about the 6-week appointment. Most of the time when you go back for that 6-week appointment and like your doctor asks if anything is up, you haven't really tested the waters.
Right. Oh,
Like,
no, not at all. Like not even the slightest.
so how can you really give feedback as to like, do things feel okay? And I think that's where people run into issues further down the road sometimes as they start to get back to activities, or maybe they want to get back, but they don't even know, like you said earlier, where to start and what to
Right.
do.
Right.
But I find it more often people are experiencing issues, and we see it in the research as well. The further along postpartum they get, actually, the more like the greater the prevalence of issues that actually comes up, and the greater distinction we'll see actually between like a vaginal birth and a C-section.
Yeah.
Um, but again, I think you're not always going to run into issues right at the beginning. It's as
Right.
you try to get back to some of those higher level activities, or maybe your kid gets, your kid's now 30, 40 pounds.
Yeah.
That's when you're having issues, not when your baby's like 12 pounds.
Right. And it's especially with like a lot of the times with the 6-week appointment, it's like, oh, now you're cleared for sex. And it's like, well, how do we even know that sex is something I should be doing right now if I've not even attempted or tried, you know? It's like, how do I know that that should be something that I should do? And I also like, when they talk about like, like you said, how do you even know that you are okay to do that? We don't even done anything. I was still bleeding, I'm pretty sure, up until like 4 or 5 weeks afterwards. And then I had my appointment the next week. Like I bled a lot after during my postpartum time. And so when she was asking me how things are, I'm like, couldn't tell you. I've just been bleeding. I don't know how things are. Like I've just been bleeding. I'm just now getting to the point where I feel a little bit okay down there. I'm like, I have no idea.
Right.
I don't know
Right.
what's normal. Like, it's
Yes,
no clue.
exactly. Like it just reminds me, I was telling someone the other day, like, I don't think I used toilet paper for like 4 weeks
Oh, yeah.
postpartum, so
No,
like
absolutely not. Yeah,
you're
absolutely
like,
fine.
again, you're not even touching anywhere near that area yourself,
No,
really, like, let
no,
alone wanting someone else.
absolutely not. Absolutely not. I didn't even really take a mirror and look at myself until probably like right before my appointment because I wanted to kind of know like what she would be looking at. And then I remember like looking at myself in the mirror and I was like, whoa, this is a lot. Okay. I don't even know if I'm quite ready to look at this yet. Like, much
Yeah,
less like a doctor and then much less my husband. Like, it just,
yeah,
the hormones are all over the place. You're feeling, so many different things. And so I don't know where we came up. Maybe you know this in the medical world, why 6 week is like the magical
hmm
number. I don't know. That just feels so soon to me. I don't know
it
why.
is.
Yeah.
It
Just,
is. Yeah. So 6 weeks is typically what we see just in terms of the uterus returning back to its
mm,
like original
right,
size.
right,
And also just in
right.
terms of like the uterus healing on the inside from the wound left from the placenta, we're looking at about 6 weeks. But yeah, that's pretty much it. That's all that's happening in that 6 weeks.
Yeah.
Typical like muscle healing, especially if we had a tear, if we had stitches. I mean, more normal muscle healing is like 12 weeks. Again,
Yeah.
like if this was your bicep or if this was your hamstring,
Mhm.
or like literally any other muscle on your body, your doctor would be telling you like, yep, this is going to be at least 12 weeks to heal. At
Yeah.
least, and then you're going to have 3 months of PT after that.
Right. Right.
You're talking like 6 months is a very realistic
Totally.
time
Totally.
frame. But yeah, for whatever reason in the postpartum world, and I think this just goes to show like the lack of support and care we have for women in this country. But yeah, 6 weeks, and then they're like, all right, you're good to go, which
Yeah.
is not the case. And so no wonder, like you said, people don't feel ready to have intercourse at 6 weeks. Like it
Right.
could be another 6 weeks before your muscles feel normal. And if your
Yeah.
muscles are still healing, again, imagine like I always tell people sex is it's like a workout it's a workout for your
Oh,
pelvic floor muscles.
yeah, definitely.
So again, if you were healing still, like a shoulder injury or your
Yeah.
bicep, and
Yep.
that 6 weeks, you're like, I'm gonna go do a big bicep workout. No
Yeah.
wonder it's gonna hurt.
Yeah. I was thinking this week, I would always use the example whenever people were feeling weird about pelvic floor physical therapy. I'm like, okay, well, if you break your arm, what do? You go to therapy for your arm. And now that I have broken my leg, I feel like I have to change my example and say, well, if you've broken your leg, what do? You go to therapy. And now I can use a real life example of that, of going to therapy for that. Just think that I maybe spoke that into existence, and I
Yeah.
shouldn't have done that. Like, I feel like I
Right.
should not have done that. Anyways, so let's talk about pain with sex after a baby. I feel like that has also been a normal thing, normalized thing, that a lot of women will experience pain with sex after a baby, and they just think that that's how it's supposed to be because every other woman is experiencing that. So like that's just what we do. So let's talk about, like, I mean, I know it's normal. It's not, excuse me. I know it's not normal, but I know a lot of women do think that it is normal. So let's talk about like what is not normal with sex after a baby, like
Mm-hmm.
wise, or maybe like
Yeah.
this.
Right. So yeah, like you said, I think there is this, we've normalized it definitely to an extent. Like I even remember my mom telling me, she was like, no, it's going to hurt the first time. And so I brought it up to my midwives and I was like, what do you guys think about this? Because like the research does show about 90% of people will report pain with intercourse the first time postpartum.
Yeah.
And you're like, is that because, again, is it supposed to be uncomfortable to some extent, or is it going to be, or is there something else going on?
Yeah.
And so my midwives really kind of challenged me in the way that they were viewing it. And they were like, are we just kind of setting people up for that
Mhm.
by saying it's going to hurt? Kind
Right.
of the same way as like when we tell people like, the first time you have intercourse, like just in your life, it's going to
Yeah.
hurt, but it
Right.
shouldn't.
Right.
It really shouldn't.
Right.
Uh,
Right.
and so again, I think some of that is we like set people up to
Yeah.
think that it's
If
going
you
to hurt.
expect it's gonna hurt, then you're super anxious. And when you know
Yes.
when you're anxious, your muscles are tight because that's a response to the anxiety. And so then it is
Hmm.
gonna hurt. So it's just like a chain reaction
Yes,
thing.
exactly. Exactly. And so again, I think there is some of that to it. I think there's also this like massive pressure for people to get back to intercourse
Yes.
postpartum. Again, they're like, you get home for that 6-week appointment. I don't know how many people have told me their husband is like waiting for them
You're
at that
joking.
after that 6-week appointment. Like maybe not actually, but like
But like, yeah.
they're
You know what?
they're like, when is it? When are we doing this? When are we
I've
doing this?
seen
When are we doing this?
a couple of Facebook groups I'm in. There was not a couple. There's one Facebook group I'm in, and somebody was saying, like, asking in there, like, okay, are we really waiting 6 weeks to have sex? And I was reading the comments, and a ton of people were like, oh, I didn't wait. I went back 3 weeks. I went back 2 weeks. And I'm like, what? Like, I'm still bleeding at that point. How are
I
we?
mean, if you want to, like if you totally want to, again, the criteria typically like you should have privacy, you should have the desire to do
Mhm.
it. You should have the energy
Yeah,
to do it, and like you should probably not be in pain.
right.
So like
I
again, it
just,
should feel good. But
but the
yeah, so
expectation, you're right, of like them just like waiting to ready to go is just that makes
right.
me sad.
Yes. And again, I think some people like, and I hear this quite often. And so I know this, I'm not like making this up, but I hear
Right,
it from
right.
people quite often who are like, no, I like really need, like my husband has been waiting and like I feel bad making him wait. And so like I really want to like, it's not about them. It's about the fact that
No.
they feel bad for their husband or they feel like they need to do it for their husband. And
Yeah.
again, that kind of brings it back to like this whole thing of like toxic purity culture and
Totally.
like, anyway,
Yes.
I'm like, I don't want to go on a rampage
No, no,
necessarily on
that's
that.
what the podcast is about. Is it's like if your
Oh.
husband can't wait 6 weeks, or I mean 12 weeks, I mean however long, you just carried his baby for him for
Right.
10 months and you pushed him out of your vagina, or gave her a
Yes.
C-section. Like, and they can wait. They
Right.
can wait.
Yes.
It's
And so
The world is
yeah.
not going to end. Sex is not a need. Like, the world's not going to end.
Yes.
You're going to be fine.
Yes.
You're going to be
Yep.
fine. Sit down.
Ex-
Ugh. Sorry.
No, you're good. And so, yeah, exactly. And so I think, again, when it comes to having sex after a baby, I think, again, there's this massive pressure. People think that they should be ready at 6 weeks. And so I think a lot of people are attempting to do it when maybe they're really not, like, and
Yeah.
maybe they're not listening to those signals from their body in a sense.
Right.
And I think there is something about the fact that maybe the last time that that area was touched or there was something either going in or out of that was like a baby. So
Yeah.
I think there is definitely something to that. But when you do decide it is time to have intercourse, you are ready, the desire is there, again, the
Mhm.
privacy is there. You were like, it's go
It's
time.
time. Yeah.
Like, it should be comfortable. And
Yes.
if maybe not right at the beginning, maybe there's a little bit of discomfort at first, but
Mhm.
that should like dissipate or go away within like, a couple minutes.
Right. And
Um,
I think it's important for us to talk about that because discomfort is different than pain. And like a little
mhm,
bit of discomfort for a second. Because, like, okay, yeah, the last thing that was happening with your vagina was a baby coming out of it. So there might be
mhm,
a little bit of just like you're feeling a little hesitant in your body. So the first initial penetration might be a little just like a little uncomfortable because you're just like hesitant in your body. And then when you see like, okay, this actually is good, you're able
mhm,
muscles a little bit more, okay, then it goes away. But I think some people think that like um that it's just going to be super pain. They say that it's going to be painful instead, and so then they're just like expecting that, and then they're anxious about it. When it's like, no, it's
mhm.
be a little uncomfortable, but if it's painful, that's
Yes. And again, like, and for some people, it may be hard to even make that
definitely
line because they may be
for
used to
sure.
being like, again, how many people have I talked to who have told me like they've never had good sex, like it's always
Yeah,
been
right.
uncomfortable. And so their level may be a little bit different
Oh, for
in
sure.
that
No, I
in
say
that
that with
regard
like very
too. But
understanding that it may be very hard for people to understand the difference between uncomfortable and pain as well.
right,
Totally.
right. Absolutely. But yeah, I think again, there is like in my mind, no rush necessarily to do things at 6 weeks. If you feel like you need a little bit longer for your body to just feel normal, for you to feel confident in your body, like that's a big aspect of
Yeah,
sexuality and your
absolutely.
pelvic floor and pelvic floor dysfunction too. So like if you feel really like kind of gross about yourself because you've been spit up on all day and
Touched
you
all
haven't
day.
showered in 4 days and like
Yeah.
your hair's a mess and stuff like
Right.
yeah, you're
Yeah.
probably not gonna feel super sexy and, like, ready to get it on with your
Right.
husband too. So again, the timing is important, but I'm a firm believer that sex after baby should not be painful, and
Yeah.
it like, everyone this is one of my goals for 2024 is that everyone knows that they can have really good sex postpartum. Like,
Yes.
really
Yes.
good sex,
They
like, even
really
better than
Oh, it's been better.
prior.
It was better after a baby, it was better sex than it was before. I never
Yes.
thought that it could get better, and then
Yes.
after I've had a baby, it has been
Yes.
significantly better. And I do think that I was cured of my vaginismus, or I know I was cured of my vaginismus. Sex did not hurt. It was not painful. Like I could have sex whenever I wanted, however I wanted. But post baby, it is even better. And I had no idea it could be even better because I just expected it to be painful or hurtful, especially
Mhm.
my history of painful sex. And so I was like, if I have this history, it's just going to be worse. But that just like was not the case. So I love that that's your mission, that to help people understand that like it can be better, because that has been my experience. And I've been really excited to share it with people as well. Because I feel like we hear so much the negative parts of it, which we should. I'm always about clearly having space for that, like sharing the negatives, but I always want to encourage people that it doesn't have to be that way. And so I'm
Mhm.
all for sharing the positives of that as well. And so I love it. I'm like with you with that. Like
Yes,
helping people know it
yes,
could be even better.
exactly, and one of the things that we're seeing I've been doing, like I was at a PT conference a couple weeks ago, so I've
Yes.
been diving into all of the different research on, like, all of these all of these different conditions and things
Yeah.
going on in just, like, the pelvic health, women's health space, but one of the key things that keeps coming up very consistently with all of these different things across all of, like, the spectrum of everything is that one of the best things and one of the highest quality evidence that we have in terms of care that you can provide is
Mm.
giving people the hope that things will get better. Like,
Mm,
that is literally a
wow.
clinical intervention that is proved to be like one of the most effective things that you can do. So
So
to tell people like again like hey this can get better or like
yeah.
you know you can have good sex
Yeah,
postpartum.
yeah.
That
It
is a
doesn't have to
huge
be this
thing.
way. Yeah.
Mhm.
That I love it. That's like clinically proven that that
I
is.
know. It's really cool.
That's amazing. Like I've been screaming that from the rooftops since I started this podcast. So that's like absolutely incredible to hear. Um,
Yes.
so obviously I'm pushing everybody to go to pelvic floor physical therapy, but unfortunately not everybody has access to that. Like I know I'm so grateful for when I lived in Colorado that I just was in a big city and had, so many options of pelvic floor physical therapists that I could go to. If I had lived in a different place, I know that probably wouldn't have been the case. And so if somebody is not able to go to pelvic floor physical therapy, they don't have access to it for, financial reasons or location or even quality care, because every therapist is different. I know that I went to
Hmm.
one that was not great. And so is there things at home that women can do to maybe help strengthen their pelvic floor? Are there different exercises that they could do postpartum? Like again, I know we're going to be pushing for people to actually go to the therapy, but if they don't have access to that, or is there things that they can do at home that
Hmm.
can help with that?
Yes. I mean, I think there's a ton of really good resources available online, and social media has definitely been like a really helpful resource for a lot of people in terms of just getting access and information about pelvic health PT. And so I am like a big advocate. There are lots of great pelvic PTs or different programs available on social media. Um,
Mhm.
I think again, if you have the opportunity or the ability to even virtually or remotely speak with a pelvic floor physical therapist who can maybe get an idea as to what's going on postpartum,
Yeah.
if you are experiencing symptoms, maybe you're not, but just to kind of get an idea of maybe where your pelvic floor is.
Mhm.
Um, is it like, are you maybe at risk, or are there things going on that maybe would put you at risk for a more hyperactive or overactive pelvic floor that has difficulty relaxing? So then you should maybe focus on relaxing or mobility drills first. Or are you experiencing more like coordination issues,
Mhm.
that maybe we need to get these muscles firing all together or like appropriately, and we need to do more coordination drills first?
Mhm.
Or do we need additional strength and support from all of these other muscles? So again, just making sure we kind of have an idea as to like what you need
Yeah, yeah.
can be really helpful. So there's a lot of different ways to do that. Like I said, like you can always go in person. There's a lot of people, myself included, who can kind of work with you virtually or in a remote capacity to do that. And then there are some kind of self-assessments available too.
Can you
Um,
work with people anywhere, or do they have to be in the
mhm.
state that you're in?
So I, at least from a like women's health coaching perspective, I can work with people anywhere. So like I
Okay.
have people all over the world.
Oh, awesome. Okay.
So just to kind of help in terms of like again figure out what would your plan look like? How do we make sure you're doing some of like doing the right things as
Yeah.
opposed to doing things that could potentially be making your pelvic floor worse?
Mhm.
And so again, kind of getting at least some guidance or idea as to like what potentially could be going on. And then from there, I think it's always important like we want really functional things that you can do. So kind of focusing on your squats and your lunges and being able to carry and do all of the things that you need to do postpartum. I
Yeah.
think those are always like good exercises or things that you can kind of look at, just function and understanding like how to breathe. I always
Yeah.
say if people are going to leave an appointment with me and like they're never going to see me again, what's one thing that they can leave with that's going to help them the rest of their life? And
Mhm.
that's going to be knowing how to breathe, like knowing how
Yeah.
to just breathe properly.
Oh my gosh, absolutely. That's so important. Like the being able to breathe properly in so many areas of your life, but especially when you're like trying to have intercourse. I know with painful sex, like once I was able to like really learn how to breathe and really learn how to relax my body, that really helped propel my like healing journey like,
Hmm.
so much. And speaking of that, I actually at my physical therapy I went to this morning, I was talking to my physical therapist about some nerve pain I've been having, and he was like, well, let's talk about some breathing that can help like when those moments happen. He's like, I bet you're gonna fail the breathing test. And I've gone to help for physical therapy. I went to acupuncture for a long time. I know how to breathe, but for some reason I like got nervous, and so I was like breathing really weird. Like I don't know, I just like got nervous and like forgot how to do the like diaphragm breathing.
It is hard.
And he was like, oh, your shoulders and your chest move, like you failed. He's like, let me show you how to like do it from your diaphragm. And like I was like, I know how to do this. I just got really nervous.
Yes.
But he was telling me, he was like, he's like, you breathe like a girl. And I'm not saying that in like a sexist bad way. He's like, hear me out. He was like, because of society, a lot of women are always sucking in and you're always really tense because you feel like you have to be skinny. And so you're always sucking in. Like that's just what girls do. And so when you're breathing in your chest and your shoulders because you're always trying to lift up and like be
Mm-hmm.
skinny. And so you're not actually getting into the depths of your diaphragm because you're just like super tense in your shoulders. He's like, it's unfortunately just society hating women. And that's why
Mm-hmm.
I breathe. And I was like, wow, that is a great point. He's like, men are usually better at breathing because they are not like super tense. And he said men don't hold a lot of the stress in their shoulders, they hold it in their back. I was like,
Mm-hmm.
interesting. But he was like, yeah, so you're not always tense in your shoulders like women are. And I was like,
Mm-hmm.
oh, that was just mind blowing. Our breathe, we don't even know how to breathe because we're trying to be skinny because that's what society has told us to do. It's just
Yes.
crazy. Anyways.
Yes, exactly. So yeah, I think those are always good things. And then again, kind of figuring out if you do have pelvic floor pain or difficulty with like a tight or an overactive pelvic floor, um, talking to a provider if you can on like is a tool like a pelvic wand or dilators, are those going to be helpful for you?
Mhm.
And do you need them? How do you use them? Are there areas you should focus on?
Mhm.
So I know so many of my patients benefit from one of those devices, sometimes both, but like that can be really, really helpful for getting that progress outside of sessions. And so like
Definitely.
that is, and that's a good way too, to just kind of like empower you with the tools to kind of
Right.
take control. And especially for someone who's experiencing pain in the pelvic floor, like pain with intercourse or pain with insertion or whatever it is, like to have to for you to kind of massage or work that area yourself, or have to treat that area yourself,
Yeah.
it really, really helps with a lot of the other aspects
Yeah.
of getting comfortable with your pelvic floor too.
Definitely. I
So,
feel like the more comfortable we are with our bodies really does help. Because if we are feeling like shame and uncomfortable about the different things, that's just going to bleed into like so many other areas and will really help your healing process if you're like comfortable with like actually, using those tools on
mhm,
your body, understanding what your body parts do, what their names are, can really help you feel like confident in yourself and help propel your healing journey.
exactly.
Okay, let's talk now about easing back into intercourse after having a baby. And so I really wanted to talk about this because I just know from my personal experience and from just talking to some of the Say What listeners, like I had so much fear of the unknown when it came to like having intercourse again. I was just like, for some reason, I was just so terrified. I was so in my head about it. I was, always told from people that it was gonna be painful. And so I just had like this built up in my head that it was gonna be painful. And I was so scared. And I just like felt like I didn't even know how to ease back into it. So let's talk about that. So what are some like maybe tips or things that we should do to like kind of ease back into this that can maybe help us not be so scared to have sex again after a baby?
So I think the big thing, like we talked about earlier, is just making sure like you feel up for it. It's not something that you're feeling really pressured about, or something like you have to do. It
Yeah.
should really be like, yes, I really want to do this, or I want to try this, and like I'm excited about
Yeah.
this. So that's always like a good a good first step.
Def-
Um, and then I think too, like and we just kind of talked about this as well. Like it's totally okay for you to check out that area first and like get comfortable, see how things are moving, see how things are working, like touch and like move your labia and like touch around the vulva, touch your clitoris, see how it feels. Is it extra sensitive? Is it uncomfortable as you're kind of stretching labia, or like do you feel some tugging or some pulling? So
Yeah.
it's always like I recommend if you can do like a self-assessment first, and that doesn't
Yeah.
necessarily mean like you don't have to get like a full mirror and check it all out yourself,
Yeah. Yeah.
but like touch yourself and kind of see what's going on. And then I always like to tell people like never forget the importance of foreplay too. And
Good.
so
Oh my gosh.
it's totally acceptable, and I would even like highly recommend, do a couple things, or like try some external stimulation even before you get to the penetrative part. But like if you can have a few orgasms before you go and try penetrative intercourse, that
Yeah.
can be a great way just to kind of like warm up those muscles, see how they're feeling, because an orgasm, again, you're going to get that contraction, that relaxation, a lot of movement and blood flow to the pelvic floor. And so if there is some healing, or if there's some tension or something happening, that may help you identify that. Or on the flip side, it just helps things feel really good and,
Yes.
like
And that can be
boost your
encouraging.
confidence.
Yeah, the boost your confidence for sure, because it may feel like you need some kind of like boost to even feel, because after you have a baby, it's like your body was you're growing another human, so it's hard to even feel like your body's your own. And so I feel like having a couple orgasms before you even actually have penetrative sex can just like boost your confidence, like, okay, this feels good again, like I am also a woman and not just like someone who just had a baby, and can really help you feel like good in your body again. And that can help encourage you to maybe get to that point where you do have penetrative sex. That is a great tip. Like, I think that's
Yes.
super awesome.
Yeah. And again, there doesn't have to be a big rush to it. I know easier said than done
Yeah.
sometimes. Um, but sometimes that wait and like waiting a little bit longer to when things do feel a little more comfortable or you feel more confident just makes it even better.
Yeah.
So
Yeah.
versus like again, if the first time is not comfortable or like is straight out painful and you're telling your partner to stop because it hurts so much,
Yeah.
how likely are you going to want to do that again, the next day or a couple days later? Like,
Not very likely.
right. So again, we're trying to create positive experiences from the beginning if we can. That
Mhm.
way it helps like people respond much better to positive reinforcement than they do like negative. And so if
Definitely.
something hurts or is uncomfortable, then they just stop doing it. And that's where we see people at like a year postpartum who are like, I've had sex 3 times or 4 times
Yeah.
because it was painful that one time. And then they feel really bad and they don't want to try it again.
Right, right. And I think a lot of times we think it just has to be all or nothing. Like, we either have to go in at this moment with our partner and it has to be like full on intercourse sex, or we just shouldn't do it at all.
Mm-hmm.
And I think a lot of that is purity culture backing as well, like telling girls not to be a tease and all this stuff, which is just so ridiculous. But I feel like that's also a good way to ease back into it. Like we were saying earlier, it doesn't have to just be jump to that, not even feel like you have to even jump to having an orgasm the first time. Maybe you just start
Mm-hmm.
making out. Because I know I didn't even want to kiss anybody, kiss Thomas. I'm actually like, I'm kissing all these people. I didn't even want to kiss my husband for a while, because I mean, we would like peck here and there, but I was like, the idea of making out just feels too just much right now. Like, I can't even, like, something about it. I just was like,
Right.
I'm just not okay to do that this moment. And so I feel like just even easing into that, like starting just by like making out. Okay, then maybe we'll add some hands. Then maybe we'll add it and just kind of build up to it. But like
Mm-hmm.
for us was a good way to kind of ease back into it. Rather than
Mm-hmm.
just like feel like it had to be, all or nothing, like jumping in.
Yep. Yeah. Same thing with like, start with some gentle massages or like having your partner like touch your abdomen or like your inner thighs or like your butt,
Yeah, yeah,
It can just
definitely.
be kind of in that way to, and like I always tell people, set the expectation ahead of time as well. You can always change your mind, but I feel like it's much better to go in saying like, we are just going to do this. Like we're only touching in this area,
Mhm.
and then to change your mind versus to say like we'll see where it goes and
Yeah.
then you get yourself kind of stuck in a situation that this sounds like so bad, but like that you didn't want to be in terms of
No,
like
for sure. No, I think that's a really good point. Yeah, no, I think that's a really good point. Those are some good tips. I feel like that's good to help people get back into it, understanding your body first before you just expect your husband to be able just to go in. Like that, I think really can help with the fear of the unknown, seeing how things feel, just touching it, and or even taking a mirror, and then, just kind of easing into it, not feeling like you had to go like all in.
mhm.
I think those are some really good tips. I feel like that could help our listeners be more confident with that. Okay, let's get into some of our questions. We have 4 questions we're going to do from the listeners, so we'll just go ahead. Is it normal to have pain with sex after needing stitches from birth? Sex did not hurt before.
So again, we kind of covered this in the sense like
Yeah.
no, you should not
Right.
have. You should
Yeah.
not have pain with sex. After needing stitches, what we do tend to see is sometimes the tissue doesn't lay quite as flat because again, we've used the stitches to bring that tissue back together. And
Mhm.
so that can kind of create a ridge or like a little bit of scar tissue at times in that area. So luckily there's lots we can do. You can either manually massage that area, you can use like a pelvic wand sometimes to kind of work out that area. So
Mhm.
it's not uncommon to have some pain after having stitches. But again, there's a lot that we can do to just really work that area and get that flat and then make things feel better in terms of sex. But again, this is a situation you don't want to continue. Like, this is not one like, just keep having sex and maybe it'll get better, because then we're going to start to create this pain cycle and this negative association with sex that even once that area is healed and those things feel better or flatter, you may still have pain. So
Definitely.
we want to address that sooner rather than later.
Yeah. Never want to push through pain. Somebody put in a question here. They said, not feeling much with PIV, which is penis and vagina. Tips to getting sensation back.
Yes. So this is another complaint I hear quite often. And sometimes, again, it's not necessarily the muscles are too tight or they're too loose. It's we're not getting enough blood flow or kind of stimulation to the area, usually in those cases. So the way that we really start to get that good sensation in terms of like pleasurable sensation is we have to have a lot of stimulation, like to the clitoris, basically to basically the sacral plexus, or like the nerves that then send signals to your brain that says like, hey, this is like a pleasurable sexual experience. And so sometimes postpartum, we just need a lot more stimulation because those nerve signals are decreased, especially if they haven't been used in a while. And so sense. Yeah. So in those cases, again, lots and lots and lots of foreplay, sometimes even stretching prior to intercourse. Again, it's not necessarily that things are painful, but they're not comfortable or they're not pleasurable. And so we need to increase blood flow. We need to increase mobility. We need to increase stimulation to that tissue. That way, again, we can actually improve those signals being sent, which in turn improves your sensation. So long story,
no, that's a
long-winded answer.
Would that be an instance where using a vibrator would be like really helpful?
Super helpful.
You get that like really intense sensation.
Yes. Yes. Super helpful. And that can be great too. Like, not necessarily, again, like that you need to depend on the vibrator, but that can be great to just to like bring in a lot of additional blood flow to the area. And that probably needs some like manual stretching. I would also be curious. I always recommend people to check out the book. And I know you've talked about this before, Come As You Are, but there's a Netflix special too called The Principles of Pleasure. And so whenever people tell me to that, like, even if they're experiencing pain, but if it's more just like a lack of sensation, sometimes I always recommend that just to get the metaphor or the analogy of like your sexual brakes versus your sexual accelerator. So again, you may be wanting to do all of this. You're like you feel like you're super in the moment. And then as you're having intercourse, all of a sudden you're thinking about, well, what if the baby wakes up, or what about all those dishes in the sink, or, I have all this laundry that I need to do. And like all of a sudden you've got this list or these things popping up in your head that are kind of, they're putting the brakes on that sexual experience too. Postpartum, again, we experience this a lot. So in addition to the physical component, I'd also recommend like, are your sexual brakes on in these experiences too?
Definitely. Somebody asked tips on exercising / working out postpartum, which ones to do and which ones to avoid. I guess like which exercises to do and which exercises to avoid.
Right. Which is like such a big, it can be a big question.
Big question.
Yeah. Like I said, we want to make things functional. So I'm a big fan of squats, deadlifts, lunges, like overhead press, things that, again, carries, things that you're going to have to do as a mom are good to always practice. My recommendation nowadays is like, I really don't want you to avoid anything necessarily, unless it like causes pain or you're getting like leakage or you feel like things are, falling out of your vagina or something when you're doing it. Like, let's readdress there. But really what we're starting to see is the fear associated with limiting activity, or the fear that you're going to injure something postpartum, is way more harmful than the exercises people are doing postpartum. And like you're way more likely actually to hurt yourself from decreasing your activity than you are from just doing anything.
Makes sense.
And so I tell people, like, yes, we want it to be progressive and we want to kind of get back. So start with your basics. Start, again, body weight squats. Can you hinge at your hips? Can you do like some supine marches or dead bugs, or, there's lots of different exercises that we can kind of look at, but start with your basics, start with the staples, and then we start to progress in terms of any sort of weight training. But yeah, you're much more likely to do harm from not doing something than from doing something.
Yeah, no, that makes sense. And I mean, and it helps you like be able to even carry your child more. Like when I was seeing
Yes.
talking about doing different exercises to be able to get your kid in and out of the crib and how that can help with your pain that you could be experiencing from getting your kid in and out of the crib. I was like, I didn't even think about that, because there's definitely, when you're doing lots of up and down bending, it's like, okay, maybe we need to strengthen our bodies since we're going to be doing a lot of up and down bending. Like that's so smart. That's so smart. Okay. Last question. Someone said advice for let me back up. Someone said advice for bad labia tear, healing / sex after my labia tore from my clitoris. I think that they're just saying, should they have sex after they heal from a bad labia tear, or should they wait? I think it's maybe what that person.
Or
Yeah.
maybe, how advice for healing and advice for sex afterwards.
Oh, that makes more sense. Yeah.
So yeah, those are always hard. So that, again, what we used to kind of recommend in terms of like labia tears is like, okay, like don't spread your legs apart, like keep your legs together, lay down, like do all of the, like, we were very specific on like don't move the tissue in the initial healing phase. Now it's not quite as strict. It's like, okay, we need to kind of get some movement to the tissue. Like you're not really gonna re-injure it necessarily by like bringing your knees apart, or you're not going to help it necessarily by keeping your legs together. I would say the key thing here is we want to be sure it heals appropriately.
Right.
So
Right.
making sure it does heal. And if not, like, can we get some additional, like something additional there, like a topical to help it heal?
Yeah.
So sometimes people will do like a topical estrogen, or like a topical, there's like a silver nitrate or something like that people will do to help that tissue heal, just because the labia is a little bit harder to get it to heal.
Right.
Anyway, once that does happen, kind of bring it back to what we said previously, like get comfortable with that area again, make sure that labia can move comfortably. It may feel, because of the tear, like it may feel like it's getting caught or like it's stuck at times. So like you could do some like self mobilization of that tissue and just making sure things move and feel okay. If it doesn't, obviously check out a pelvic floor PT. And if it does, like, again, just kind of ease back into intercourse and you should be totally good.
Yeah, I had a labia tear, and this was just one of the like negatives of, the care from the hospitals. After I pushed Tate out and I'm holding him, they're like down there, like starting to stitch me up. And I literally was like, nobody is telling me what is wrong with me. Like nobody's telling me that like something tore, what's going on. So I'm literally looking at my doula, which she obviously was like, knew what was going on, but she was making sure that baby and me were okay. And then I was like, hey, can you like tell me what's going on down there? Like, am I okay? Like, I need to know what's happening. And she like went down and looked, and she was like, can you guys tell me what's happening? Like, what are we doing to her? It's like, it's so crazy that they just like jump in and do stuff to you without like telling you what's going on either. But then no one ever said anything to me about how to take care of the labia tear after it happened. I was never told like, oh, it could be swollen for a while. It could not be swollen for a while. It's going to be sensitive to the touch for a while, or it's not going to be sensitive to the touch. Like no one told me anything. Like no idea. And so next baby I have, and if I don't tear, I'm not even gonna know what to expect my vagina to look like, because I don't know what was normal and what wasn't normal with my tear. Like no one said anything to me about it. And I didn't even realize like I should be asking questions about it until it was like I got home, and weeks later I was like, oh, I guess I did have a labia tear. Like, what's going on with that? And at my 6-week appointment, I was asking her, and she was like, oh, it looks fine. And I was like, glad it looks fine. Glad that everything healed up right. I just got lucky, I guess.
Yes. Yeah. And there was something I was going to say regarding that too. Oh, I remember now. But basically, that's all to say too. A pelvic health PT can be, and we're working on this in terms of like, everyone again should have access to a pelvic PT even in the hospital, whether you had a vaginal birth or a C-section. Like especially, there was this whole chart I saw at a talk I was at recently, and it was like, when do you refer to pelvic PT in the hospital? And it was literally like, if anything happens during birth, if you have a C-section, if you have any kind of tearing, if you have like significant blood loss, if like there were literally all these things. The only time you wouldn't refer to pelvic PT is like it was absolutely everything was 100% perfect. And then you would still give a referral for outpatient pelvic PT. So again, that's all to say, like, those are instances where if you have a labial tear or like a tailbone injury or your pelvis hurts postpartum, a pelvic PT is a good person to have on your team or a good contact point or a good resource in those first 6 weeks, because they can kind of troubleshoot and work with you on those pain issues. Like they can tell you what to do. Like, how do I help this? Sure. Like I had someone the other day reach out. I've seen her throughout her whole, I saw her after her first baby. I saw her throughout her whole second pregnancy. Now she's postpartum with her second, but she's having a lot of hemorrhoids. And she's like, what do I do, Lindsay? How do I make sure I'm not making this worse? And so, and again, that's at like a few days postpartum, she's reaching out to get that information. So again, I know it's not accessible yet. It will be one day.
It will be
for everyone.
We have to keep providing that hope. Like it will be. And I was thankful that at my 6-week appointment, my gyno did ask if I like wanted a pelvic referral. So I was thankful that she asked me, but because she was very much on our end of like, it's so ridiculous how in the US that nobody talks about this. And she was just like all about it. She was like, this is how I give it to every patient. She's like, I know you're telling me you don't need a referral, but I'm writing it down in case you ever call and need one. Like it's in your chart. And I was like, thank you. I was like, I do have a great PT, but thank you for, at least making sure like if for some reason I needed one, it was in there written down. Like it's just so helpful. Well, this has been a great episode. I feel like we have learned so much. Like this has been so good, like talking about postpartum, easing back into sex. I think this is going to be so helpful for those who are pregnant or want to be pregnant one day, just to like help prepare themselves and like know what to expect when it comes to sex postpartum. So thank you so much for talking us through all this stuff and answering questions. Where can people follow you? Please like let us know all the things, like keep up, and I'll tag it or link it all in the episode notes, but like tell us how people can keep up with you.
Yeah, perfect. So you can follow me on social media. My account is going to be Dr. Lindsay Massumi. And so you can follow me there. Our practice that we have, we see people in person as well as, like I said, virtually. That is going to be called Virtual Physio LLC. And so again, you can check that out. And then we do have a whole other company that makes pelvic health products. So dilators, pelvic wands, vibrating pelvic wands. We offer a lot of education and support there. And that's going to be New Flora. And so definitely check that out. We worked really, really hard to, again, make those pelvic health products accessible and a little bit more affordable for individuals too. And so that was like our big mission with that company. But yeah, follow me in any and all of those places. Please reach out at any point. You can always schedule, if you're interested in working with us, you can always schedule a free consult with me just to see, what options you have and how I might be able to help you. So I'm always here as a resource.
And you said with the coaching too, you can do it from anywhere. So you don't have to be in like whatever state you're in. So
exactly.
Good. Sweet. Okay. Well, I will link all of that in the episode notes, you guys, so that way you can follow her. So make sure you follow Lindsay on all platforms. She has such good content, such good knowledge, provides hope, and you're just a good follow. So give her a follow. But thank you guys so much for listening to today's episode. We had so much fun chatting with you. We will talk soon. Bye, friends.